He's Nigerian, amazing surgeon, amazing. And then he's done some extra training in university. See if I can get him and come back in. I'm sorry. I'm back in. Just talk to him. So he'll be joining really soon. Hi, Mrs. Gbuile. Welcome. I'm waiting for your husband. No, I don't know where he is. Hi, Dr. Camila. Hi. Okay, here we go. Let's see if he can join me. All right. Thank you. Thank you. Hey, how are you?
How you doing?
Good. How's your clinic day going?
Not bad, not bad. We were wound up early because of this, so.
Okay, that's good. Well, good, because your wife is on here, so she'll know that you need to go home on time.
Oh.
Very good.
Yeah.
Well, like today, I was just hoping and praying I didn't have an emergency, and it came so close.
Oh,
the
wow.
life of an OBGYN. Oh my God,
Yeah.
we never can plan things. And I have, like Nigerians say, san in our gari.
That's
So,
right.
so guys, we're going to get started.
Yeah,
Dr.
absolutely.
Ben is a board certified plastic surgeon. He's also board certified by the American College of Surgery. He went to med school in University of Lagos. He graduated top 5% in his class, so we're not talking about some rubbish person. He did his residency at Howard, and he did his plastic surgery fellowship in St. Louis.
St. Louis U, that's right.
And then he's done some extra training in University of Tennessee and in Paris.
Yes.
So you have had the whole gamut. Like,
yeah, it was fun, with everything going on now, like seeing what's going on in Europe and stuff. Had a great time in Europe. I spent 3 months there in Paris. It was a great experience. Necker Hospital is the busiest craniofacial hospital pretty much in the world. So that was
wow.
Yeah.
Hi, Donna. My office manager just joined. She's
nice.
awesome. Yes. So guys, one of the things that's really important in surgery is one of those things that you cannot just read in a book, right? So a lot of us can continue to move our knowledge more and more. But when you see somebody that's been trained in different places, seeing different kinds of anatomy, different presentations, you know that this person comes with a lot of skill set because they have this varied experience. And that's what you want, right? Would you say that, Dr. Ben?
Oh, absolutely. No doubt about it. There's more than one way to skin a cat. And you know what? There is no one right way to do it. You just need to know that whoever you're dealing with is somebody that can give you an overview and individualize your treatment for you, as opposed to just doing it one particular way for everybody. So.
Okay. I have to pause really quickly and tell one of my mentors, Dr. Kanisha, I see you, girl. Thank you for joining. So, Dr. Ben, before we get started, right, what is the first restaurant? And it has to be a real restaurant. It can't be carry out. The real restaurant, first restaurant that you're going to go to, take your lovely wife to after this craziness.
So you're going to laugh because it's going to be like the least place you expect. And the reason is...
You better not say Mama B's.
Oh, it's not Mama B's. It's actually probably going to be because the kids love Texas Roadhouse. So we don't get to choose where we go. So it's not some upscale anything. We're just going to go to Texas Roadhouse so they can throw the peanut shells on the floor.
Yes. Okay. I like it. I like it. Well, your wife will hold you to it.
Oh, absolutely. That's fine. That one we can easily afford.
We can easily afford. Okay, good. So I told the audience a little bit about your educational journey, but I want to know a little bit more about you, and I want to know about Posh Mansfield, which I saw forever when I was driving by, and I
Yeah.
had no clue that
Yeah.
a Nigerian boss
Yeah.
owns this.
Yeah. So interestingly, the name. So why the name Posh, right? So I've been here. I've been in the area for almost 2.5 years now. And prior to that, I actually was an academic plastic surgeon in Memphis, Tennessee, and I owe a lot to Memphis. I trained there. I worked there. I used to do a lot of microsurgery reconstruction and stuff like that there. And I have to say that the process of picking that name Posh was pretty interesting because there were so many like, what you guys think, like between my group of friends and everything. And I have to say, I had so many different names. I'm not even gonna make them. Some were even accused of sounding like strip club names. So I was trying to pick a name for the practice. Like that's how bad it is.
Yeah.
But I have to give Andrea McKinnon. I have to give her props. She's a very good friend. Her husband Lance is one of my best friends. He's crazy. We met because he's a rep for the company KCI that makes wound vacs. And we met and we interacted at work and we just became friends. And all of a sudden we're hanging out, nothing to do with work. And then I got to meet the wife. His wife obviously got to meet my wife. The kids got to meet and everything. And when we're going through this whole process, okay, I knew I was coming to Texas. I really wanted a name that would typify, okay, this is something classy and something skilled. And she came up with that name. And I just have to give her props. Thank God she didn't copyright it. So.
Yeah, I love it. I love it. Hi, Dr. Sales. I see a lot of people here that I am so excited. My cousin Natasha is here. Natasha, you're a supermodel. What you trying to do, girl? Anyway, so let's talk. Let's get to it. Get to it. What is a mommy makeover? Because you hear it all over the place. And I know that it has to be really specialized for what the person needs. But what is your definition of a mommy makeover? Because I'll tell you mine.
So a mommy makeover is whatever it means to that particular mommy. Obviously, yesterday was Mother's Day, so happy Mother's Day to all the mothers out there. And basically,
and the future mamas, and the dog mamas, and the plant mamas,
and the ones that don't even know their mamas yet.
Oh yes, come to me. I'll take care of you. Then I'll send you to Dr. Ben. Dr. Ben can put you back together again.
Yeah, but anyway, basically, obviously, pregnancy and things like breastfeeding stuff, they do cause changes in a woman. The abdominal wall stretches out. The hormones will make you deposit more fat. Now, the majority of these changes are to some degree reversible. But then, of course, one person's pregnancy is not the same as the next person's pregnancy. Some people have twins, some people have big babies. It really stretches out the tissues even more. Then, of course, the changes in the breast tissue, when you get pregnant, the breast engorge because, again, you're ready for breastfeeding. And then, unfortunately, when you now have the baby and you do breastfeed, usually when you engorge with breast milk, it stretches out the skin. And then when you feed, it deflates. And all these kind of like, with time, will stretch out the ligaments of the breast, and the breast typically will descend and the nipple will go lower and stuff like that. The other thing that also kind of like does this as well is weight changes, weight fluctuations. And that's all honestly what happens in pregnancy and after pregnancy as well. So all of these are external changes that occur during the course of pregnancy, childbirth, and then of course good old age, right? So usually a mommy makeover.
And then gravity.
Yeah, gravity will always win. Yeah. So anything
always win. I like that. Gravity will always.
It's always going to win. It always does. You can just delay it. My job is to try and mitigate it and delay it. But I'm smart enough to know it's eventually going to win. But that's why I come back and we'll do a touch-up. That's it. So, but anything that improves the breast, anything that improves the belly, quite honestly, you being an OB, you could also argue that things like vaginal rejuvenation, that's also part of it.
Yes.
So anything that just puts things back kind of where they were before. So, it's really basically getting that mommy's body back to how hot she used to be, and that's about it. Yeah.
Awesome. And I think that one of the things that you pointed out that needs to be emphasized is it is different for each woman. So
Absolutely.
If somebody's offering you a package that is pre-made, that's not personalized, right? What if you don't have any issues with your breasts, or you do like the fact that your breasts got bigger and a little bit saggier? Because some women have very little breast tissue until they go into pregnancy. So they like that.
Yeah.
And they like the shape. But then maybe, you know, they had a C-section and they want to revise their scar, for instance. Like those are things that I think will be necessary for us to like discuss for each woman.
So one of the things that I do in consultation with a patient is I do the consultations myself. Sometimes my staff might have some preliminary stuff, but I'm the only one that can recommend any treatment to anybody. And that's because I have to individualize it. So I usually stand in front of the mirror with a patient because honestly, what you say and what you see are not necessarily the same thing. There's body dysmorphism, which is really, really rare, but you always want to make sure, I want to make sure that what the patient is complaining about and what I'm seeing are actually kind of like running together. That way, we know that we can individualize a plan for her and take care of her.
I love that.
Yeah, but in terms of what to do, so for one person's mommy makeover, it might just be breast augmentation, nothing else. If you have a small frame, and let's say you had A or B cup breast before you got pregnant, and then all of a sudden you got pregnant, you had a couple of kids, everything stretched out. When I deal with patients that are relatively small cup size and not very ptotic, ptosis means that the breasts have descended and the nipples are pointing down. That's a medical term. One of my favorite questions to ask for relatively small breasted patients who want an augmentation is, how did you look in pregnancy? How did your breasts look in pregnancy? And did you like them? Honestly, usually that gives you an idea of what that patient is trying to achieve. Because if they're not very ptotic and they've just lost volume, then that's all you really need to do is put an implant to replace that volume. However, when patients actually were relatively bigger before, and then of course with time, with pregnancy, they got even bigger, and then after a couple of babies or so, and the things that deflated, that's when you now say, okay, how much tissue do you have? Do you have enough breast tissue that you're happy when you're wearing a bra without padding? Well, usually if you're already happy wearing a bra, you just don't like the fact that they're a little bit on the saggy side now, that's what a breast lift is for. When it comes to a breast lift, there's a breast lift and there's a breast lift. There's a breast lift that lifts the nipple this much. There's a breast lift that lifts the nipple this much. There's a big difference. So basically, that's why, and these are just options for the breast alone. We've not even talked about the belly. We've not even talked about other areas that have collected fat. Some people have bra rolls that they want you to suction stuff. So you really need to speak with somebody or deal with somebody who can give you a comprehensive evaluation. And of course, you know, my patients are going to tell you the first question I ask them before we even go into the consult about what you're trying to get is your health questions. I don't care how much money you're going to pay me. If you're not healthy enough to get the procedure, I'm not going to offer
Say that.
You know, so that's it. And that's one reason I always crack it. So I used to train residents, and one of the jokes I used to crack with them is, you know, I really like the way my license and my board certification look on my wall in the office. I don't want to lose that.
Don't want to lose it.
Yeah, and that's the difference, because you can go anywhere. You know, you really want somebody who has meaning and can go over your options with you and guide you through those options. Now, I think we chatted before about things like medical tourism and stuff like that. That's where you can go out of the country and get work done. But I keep telling patients, your body, in church we say the body is a temple. Well, I tell you, your body is a human, living, breathing thing that you need to take care of. So the fact that things are going well today does not mean that things are going to go well 3 months from now, does not mean that things are going to go well 6 months from now. So when you go to the Dominican and you get all the stuff done, and then you come back, and then, you know how many calls I get? Oh, this patient wants to see you. They went to Dominican, they have the stuff done, and now they have problems, and it's 3-4 weeks before since the surgery. Well, of course I'm going to see that patient, but I'm like, why did you do that? You know, you need to go somewhere where you can investigate, you can know that your surgeon is well trained, and more importantly, get your post-op care. You know,
so I always tell patients this: 2 things. Number 1 is you only get one body. You cannot return it, go and say, please give me back, refund. No, this is your body. That's the first thing. And then the second thing is that, you know, it's not really that you get what you pay for. It's really that you never want to go to somebody that cannot manage your complications. Because as a surgeon, I know no matter how good I am, there's going to be a complication someday, somehow. So you want to make sure that you go to somebody who, one, has the proper training, has the track record, but can continue to take care of you so that they can take care of your complications. That's right. And are you going to go to Colombia or Dominican Republic or Dubai every single time you have a complication? No, you're going to call Dr. Posh.
Yeah, exactly. And you know what? The one thing I'll say is when she call me, I'll be there. And you know, I pride myself on that. I love to tell you, oh, I don't have any complication. I would love to say that. That would just be called a fib, and I don't fib. So yes, things can go wrong.
Actually, it's a big fat lie. Forget this.
I'm trying to make it sound nice, but it's just true. You know, but the bottom line is you want to be available to fix those problems. And sometimes it does take a while before those problems show up, you know. So having, you know, the ASPS, they have this promotion where they're trying to tell patients, listen, certification matters, you know, because the stuff they make us go through to get certified by American College of Plastics, American Board of Plastic Surgery, that's who you want to be dealing with, because nobody wants to go through all that and mess up on one patient.
Exactly. Well, I want to say hi to Dr. Gbuile. She's opening a practice in Cedar Hill, so I have to connect you guys. She's an OBGYN.
Oh wow!
So, awesome. Yeah, we're gonna connect you guys. Okay, so you talked about how you get as soon as the patient walks in, you're asking about their past medical history, past surgical history. You're trying to get a good history and physical. You talked about how you do the physical, which I think is phenomenal, standing in front of the patient, trying to make sure they get what they want. But who do you deem is a good candidate, and who would you say right off the bat, hey, ma'am, I know you came in here with a Louis Vuitton suitcase of money, but I'm not going to help you?
Yeah, but they can leave the money if they want to be nice, but I'm still not going to help.
They can just leave the Louis Vuitton for me.
That's right.
I'll take it.
No, that's a very important question, because you need to have a stable state of health. And, you know, there's a lot of people with comorbidities. A comorbidity by itself does not mean you cannot have elective cosmetic surgery. And remember, I called it elective, so there's no emergency, and cosmetic, so there's no medical threat. So it doesn't make any sense to then make the elective cosmetic surgery be the medical threat. So if you have high blood pressure, then you want to make sure that your blood pressure is controlled. If you have like significant obesity, then we want to see that you have a downward trend. There's certain surgeons have different cutoffs, procedures. Usually the ideal patient would have a BMI, which is your weight over height squared, less than 30. Now, the majority of people don't. Then that down brings the next step in evaluation, as in, okay, where is that patient carrying the weight? So for instance, if you're examining a patient for their abdomen, for rejuvenating their abdomen and making them back to where they were before, you want to be able to distinguish between visceral fat, which is the fat behind the belly wall, which is around the organs, and parietal fat, which is the fat under the skin, which liposuction can treat. So usually if you have somebody whose muscles are bulging, it's bulging for either because there's a lot of visceral fat pushing against it, in which case I can liposuction that person till kingdom come.
Doesn't matter.
Not helping them. Or that they just are lax. But usually you want to be able to differentiate that. But back to the health thing. So you want to make sure they're not on blood thinners. Why? Because blood thinners obviously can cause bleeding. I want to make sure that they don't have any cardiac things. Usually the majority of mommy makeover patients are going to be in the 30 to 45, 50 range. There's some people that show up much, much later for their mommy makeover. I'm proud to say I've actually operated on a 71-year-old lady who had a full-time.
My mama might be coming to you. She wants a.
And this, and my patient, she did well. But that's where what's it called? Stratifying the risk is very important. So that patient that was 71, she didn't have any significant medical problems. But even that's not a patient I would do in my office. She was done at an accredited ASC with a board-certified anesthesiologist, and right from beginning to end, she was like properly monitored. Doesn't mean that other patients are not monitored, but then each person has their own risk stratification, and obviously I put her higher just because of her age, but she did fabulously well. And that's kind of like what I mean when I say the first question is, how healthy are you? You know, and then the other thing is, just for my part, I'm proud of what I do. I want to make sure that whenever you get done, you can maintain it. So for me, cosmetic body contouring is not for somebody who just wants a quick fix and roll on. It doesn't work that way. I have taken out 4.5 liters from a patient before, and she came back 6 months later, almost the same exact weight. So this is not weight loss surgery. You know, so trying to make sure that we select those patients. And let me just say another thing. The fact that you're not a candidate today doesn't mean that you're not a candidate next month. So my job, and I tend to offer patients and say, listen, if your problem is you come to me, you want to look better, and I identify that your problem is, it's not that you have your belly that we need to fix, it's just that you're actually obese and we need to get you to lose weight. Would you believe my practice actually has a personal trainer that I can refer patients to?
Very nice.
Yeah, because that's important, because I need them to lose the weight. Because if they're not losing weight and their trajectory of weight is on the up and I'm doing the surgery, I'm literally wasting my time. And my goal is not to take money. My goal is to provide a service. So yeah, so things like dieting, I try to talk to them about dieting. Occasionally, I might even prescribe weight loss medication for them if their health's clean and clear. And basically, again, dieting, exercise, and the whole 9 yards. And I offer them to come in and check on them every like 30 to 60 days. And then once they're ready, because I don't want to turn you away because you're 30 pounds overweight, when I know that if you're driven, you can come back in 3 months and you'll be down by like 10, 15 pounds, and we can do your surgery 3 to 6 months from then. So it's really a whole package that is individualized for each patient. So
yeah, that's awesome. You know, I feel like here it's a little bit different, but you go to Miami, you go to LA, there's a plastic surgeon around every single corner. So I wanted to ask you, how do I pick the right plastic surgeon? I can tell you how to pick the right OBGYN. I'll tell you what to do, but how, minus the, let's say universally the person has board certification. How do you then pick the right person for you?
I would go by, if you have access to, I think patient reviews are great. I think that usually as a discerning person, you would know when a review is genuine and not overly effusive and, you know, just best thing since sliced bread. But I look for reviews that actually talk about specifics, like, oh, he checked on me the day after, et cetera, et cetera. And then if everybody that you're looking at is board certified, before and after photos are good, with a little warning there, because some of them, I don't want to make any accusations, but just keep your mind open when you look at the before and after photos, and just be careful, because some.
What you mean, the angles?
The angles, there's some mumbo jumbo and some photos. I'm going to be first. I try never to do that and make sure. I actually go out of my way to try and get the same angles. But that being said, I think that if you're board certified and you have a good patients that have said good things about you, and then the other thing is, for me, if I walk into a room to see a patient and we're not laughing with each other in the first 5 minutes, I'm not your surgeon. Period. Reason, I need to take you through a journey of improving yourself, not just from the surgery, but from everything. And if we don't have a good rapport and you don't trust that we're going to have that good rapport, then we're not clicking, you know. And I'm kind of like that with my patients. You know, my patients, I love to say love me, and usually if they don't, that gives me pause. And he actually asked me, are you sure you want to operate on her? And that's a good question that I ask myself.
My staff will tell me, like, Dr. Rumla, we're not doing this case. Like, love it.
That's important. Yeah.
So one of my friends, Zemo, hi Zemo, he said, what is the most outrageous request you ever got from a potential client or for us patient?
Oh man, outrageous. Huh. I don't know. That one caught me off guard. I haven't really thought about it.
Nobody's asked you to make them look like Beyonce when they're not?
Well, no. I mean, Queen Bee, nobody looks like Beyonce. So anybody that asks me that they can turn around and leave.